Malaria remains a burden to many of our households. And as a country, we are working together closely, both the national government and the county government, to ensure that the prevalence of malaria continues to decrease every other day. And we want to promise the people of this country that we are looking forward to providing an available, accessible, affordable, and acceptable quality healthcare all the time. Out of the 5.5 million cases reported in 2023, 10 counties reported 4.9 million cases. And this is represented as 90.3% of all the cases in Kenya. And these counties include Siaya, Busia, Kakamega, Migori, Kisumu, Homa Bay, Bungoma, Turkana, Vihiga, and Kwale. Notably, Busia, Siaya, Kakamega, Migori alone contributed 53.2% of all malaria cases in the country, underscoring the need for intensified interventions in these regions and the counties. We need to strengthen linkages to the Social Health Authority. This is to enhance registration uptake and expand coverage for malaria prevention and treatment services. We therefore encourage everybody, each one of us, to register to the Social Health Authority to ensure that individuals and citizens are accessing benefits at the primary level, secondary level, and equally the tertiary levels. We need to promote collaborative and innovative and well-funded action to sustain the fight against malaria and protect the health and future of the millions of people. We need to strengthen the multi-sectoral collaboration with national and county governments to sustain and enhance malaria control efforts. Third, we also need to encourage continued and increased investments by our partners across board. And the recent pullout of the US aid funding is equally a disruption. However, we need to highlight that there are urgent needs that need to be dealt with. One being the increased investment at both national and county levels. It is important to note that domestic resource mobilization, stepping up to allocation for malaria control will safeguard the gains made so far and will accelerate momentum towards malaria elimination. We have carried out indoor residue spraying campaigns in Busia and Migori counties in 2024, achieving over 95% coverage and protecting approximately 2 million people. And there is a subsequent campaign in early 2025 in Busia County that maintained this high performance, contributing to a remarkable 50% reduction in malaria incidence from 746 to 358 cases per 1,000 population. Over the past 1 year, Kenya has undertaken critical interventions that have accelerated progress in malaria control, and one of it being the conducting of an end-to-end digitalization of mass net distribution campaign. And this campaign delivered 14.6 million long-lasting insecticidal nets across 24 counties, and we reached 4.5 million households, and that covered a population of about 28 million people. This was against the target population, but we managed to reach 94% of that target population. In the past decade, really, we have witnessed a renewed vigor in the fight against malaria, and this is leading to substantial progress across the country, and especially in our country, Kenya. And this is because of the collective national and county level efforts that the malaria incidences have reduced by 25% from 2016, when we could experience 112 per 1,000 population, to 84 per 1,000, 84 cases per 1,000 population at the end of 2024.